Hello, this is Cam from Pulse Cardiac Health, and in this video I am going to be talking about coronary bypass surgery. So coronary bypass surgery, we're talking about the coronary arteries, the arteries that feed your heart. Your heart is a hollow muscle and it pumps all day, every day, and it needs fuel to do that. And it's the coronary arteries, the arteries that sit on top of our heart muscle, that deliver the fuel to that heart muscle that keep it beating. So when you have a problem with your coronary arteries, with blood flow, you may have plaque buildup in an artery that narrows it. Sometimes something needs to be done to open things up or bypass around it. So in this video, we're going to be talking about, I mentioned coronary artery bypass surgery. Some people call it coronary artery bypass graft surgery because we're putting in grafts. So CABG for short, CABG. Some people simply just call it bypass or heart bypass surgery. So we'll call it bypass surgery because that way it's shorter. So why would you do bypass surgery instead of putting in stents or something called angioplasty? Well, there's a number of reasons that you choose one over the other, whether it's stenting or bypass surgery. Sometimes there's nothing that can be done with these coronary arteries and the best treatment is medicine. But generally, when you have blockages in all three main coronary arteries, if you're not sure about coronary arteries, there is a video on the website all about your heart's circulation system, and it talks about the coronary arteries in more depth. So generally you have three coronary arteries, and if you have critical blockages, so blockages that are greater than 70% generally are considered critical, then bypass surgery may be the preferred method of fixing these arteries. Okay, there's another reason as well, and it's something called your left main coronary artery, and it's the stump of a very large portion of your heart's circulation. And if it has a blockage greater than 50%, that's considered critical, and generally the rule of thumb is to do a bypass in that situation rather than stenting and angioplasty. Okay, now there are other factors to consider. Generally, if your heart muscle is weak and you have blockages in all three, bypass is a preferred way of fixing them. Also, if you have diabetes, people generally do better after bypass surgery.